Kia ora koutou. I'm Associate Professor Jason Gurney. I'm an epidemiologist and the Director of the Cancer and Chronic Conditions, or C3, research group at the University of Otago, Wellington. I'm also a very proud member of the Perioperative Mortality Review Committee. I think my role in the committee is to help communicate the latest evidence in the area of inequities in post-operative mortality, particularly for our Māori population. Our research group is quite active in this area. We've just finished quite a large Health Research Council grant just looking specifically at that area. So it's really my pleasure to be able to bring that experience to the committee and plug those findings straight into the committee. In epidemiology, I think that we can kind of overcomplicate things unnecessarily. We sometimes forget that the information we're creating needs to actually be digestible by those who might use it in the end. Of course, there's kind of a balance that you need to hit. You don't want to oversimplify things to a point where the information actually becomes pretty useless because it doesn't represent anything in the real world. An example of that in our own infographic that we've created here is how we've split the rates of post-operative mortality between acute settings and the elective or waiting list settings. So acute procedures are mostly undertaken because someone might die if they don't have the procedure. So it's kind of natural to know that the risk of post-operative mortality is much higher among those who have an acute procedure relative to an elective or waiting list procedure. So if we were to just combine those two together in sort of one result, it wouldn't really represent anything or anyone in the real world. So that's why we split them. Now, it's about keeping it simple, but not stupidly simple. I think the clinicians around the Motu are going to find the Explorer quite useful. It's designed for those people, those clinicians who have been approved, quality of risk managers, academics, researchers, etc., who'll be able to kind of quickly examine the data with their own lens rather than wading through those POMRC annual reports, for example, which might not have the information that they're looking for. The tool is divided into three key areas: equity, district, and procedure. So in the equity tab, for example, users can explore by ethnicity, gender, deprivation, etc. to see patterns in mortality rates and admissions and trends over time, which is quite useful. And it also allows comparisons between districts over time. So it'll be useful for organisations like Te Whatu Ora and districts within Te Whatu Ora to see how they're tracking in terms of surgical mortality relative to other areas. The data does remain non-identifiable and population-based, so privacy remains intact too. Unfortunately, the answer to why there is inequity in post-operative outcomes for our Māori and Pacific peoples relative to other populations really isn't that straightforward to answer. It's quite complex. But essentially, it does boil down to our Māori and Pacific populations having poor access to the determinants of good health. And this is particularly evident for our Māori population. So this starts right at the top with our social determinants, which stem all the way back to colonisation and the embedding of institutionalised racism within our society. And it manifests sort of further down the chain to things like poor access to primary care, poor access to secondary care, poor access to resources in the first place. Then we really need to think about how our system is organised and how well it suits our majority European population relative to our minority Māori and Pacific populations. Now, essentially, we have a system that's designed to work well for the majority, so it's relatively unsurprising that it isn't working too well for the minority.